which test do you rely most for diagnosing Lyme?
So the same test from Quest, Bioreference, LabCorp has different yields. So it's not really the test that matters, it's who does the test. There is a test, the ELISA test. You know that the current rule, standard of care is to do two tests, an ELISA test, which is a screening test. And if the test is positive, you confirm with a Western blot or Immunoblot, which is your question. The best test is to do Western blot, or best test is Immunoblot. It's more accurate. The ELISA test is a very poor quality test. And many people have this ELISA test, screening test, and the test is negative, and the doctor follows the guidelines and does not ask for a Western blot. So me, I always do Western blot. I may do ELISA or not, but I will always do Western blot, and it depends on the lab, of the quality of lab. The best things to understand is that there are controversy over Lyme disease, and we interpret Lyme disease tests with different ways. But where do we have this strength to challenge the medical authority to say, oh, he may have Lyme despite of what you call a negative test? Where do we have that from? We have that from co-infection. Because when you have a test, a questionable test, you can always argue, and you may be right, and you may have strong reason to challenge me. But if I find that you have a questionable Lyme, maybe you are positive for tick-borne rising fever, you are positive for anaplasma, you are positive for rickettsia, you are positive for Babesa and for Bartonella, and quite often people have 5 or 6 infections. So then you know that the questionable Lyme disease test is no longer questionable. But if you have only one Lyme disease test, what do you want to believe me, rather than your other doctor who just look at the rule as there are, and they tell you there is no Lyme. So the most important reliable test is a comprehensive test. Never do only Lyme, do all co-infection. It's from there that you will have evidence of a tick-borne diseases.